Hi guys, welcome to review number 8. This week we have Dan in the hot seat, so just a quick recap. We've had a few interesting papers recently. We've looked at ballet, place kicking, ACL rehab. So those are the few recent ones that we've done. You can take a look on our YouTube page as well as a Dropbox showcase. If you're interested, let us know. We'll gladly send that link over, but most of it is all on our YouTube, our I Measure You YouTube page. But let's get into this week. Dan, what have you chosen this week?
Thanks, Shane. Yeah. Hello, everybody. This week is another paper from a group at Aspetar. So it's titled Lower Limb Kinetic Asymmetries in Professional Soccer Players with and Without Anterior Cruciate Ligament Reconstruction. And there's a subheading to the paper title, which is 9 months is not enough time to restore functional symmetry or return to performance. So this is a paper from this year, and it's from Paul Reed, Sean Orliff, Matt Wilson, and Phil Graham-Smith.
Cool. So already there's a few landmines in that paper. You know, when we're looking at a couple of weeks ago, we looked at outcome versus time-based, which you reviewed from Atal Thompson, I believe it was. So, there's a landmine there that 9 months is not enough time. So do you want to explain the reason behind this, Dan, how, where that got to, why we're there, etc.?
Sure. So I actually identified this paper off the back of the review we did a couple of weeks ago. And look, ACL injuries they're a catastrophic injury. They're very common, let's say, in football in particular and other team-based sports. And there's a lot of debate around time-based, criteria-based return to play. Ultimately, given the nature of elite sport, the objective is to get the athletes back on the pitch playing as quickly as possible. And I think it's really necessary for studies like this to enable understanding of what functional performance outcomes are at different time periods following ACLR, and to understand how they actually compare to a healthy athlete or an athlete who hasn't suffered from an ACL injury previously. So that's my kind of thought process behind choosing this paper. It was a fairly complex paper to understand. There's a lot going on. There's a lot of metrics to kind of identified and considered, but hopefully I've done a fair job at going through it in a decent amount of depth, and I'll do a fairly good job at reviewing the paper.
Cool, good man. So let's look at what did they do? What were they looking to achieve? What was their hypothesis, etc.?
Well, I tell you what, let me jump straight into it. I'll share my screen and we'll crack on. So if we move into the background and objectives. So again, as I've just alluded to in that short introduction there, ACL injuries result in a significant time away from sport, often require surgical intervention, and probably more importantly carry a high risk of re-injury. So 20 to 25% was the numbers cited in this paper as those that will suffer a contralateral tear or graft re-rupture. Residual interlimb deficits can and do persist for up to 2 years. That's indicated in the literature. And we talk about time and criteria-based return to play. I mean, there has been research that's indicated that the risk of re-injury can be reduced by 50% for every month return to sport is delayed for up to 9 months. So that's an interesting point to note straight away. Obviously, residual interlimb deficits are a possible contributing factor to poor outcomes in athletic populations. And comprehensive appraisals of movement strategies are warranted during the rehabilitation period and key clinical milestones in particular. And in this paper, the researchers looked at the counter movement jump in particular for the reason that it's a bilateral task. It does open up the opportunity for your participants to adopt compensatory strategies, and that's particularly what they were interested in when analysing the performance outcomes at various stages post ACLR. So if I go into the objectives of the paper, they identify two aims really, and I'll read these because these are direct from the text. So the primary aim was to examine kinetic parameters recorded during a counter movement jump in professional soccer players who had sustained an ACL injury and compare performance with those of match controls. The secondary aim was to determine which kinetic variables best distinguish between players with and without a history of ACLR at different stages of rehabilitation. So the authors hypothesized that reductions in asymmetry would be observed by players in the later stages of rehab, but performance outcomes would not match those of healthy controls. So that was their hypothesis, and that significant between limb differences will persist greater than 9 months greater than 9 months of rehabilitation, indicating residual compensatory movement strategies. So they had the thoughts and theories that even at 9 months and beyond 9 months, the athletes who had suffered ACL rupture and had undergone ACL reconstruction would show compensation strategies in their counter movement jump performance.
Okay.
So in terms of the methodology, the table of characteristics is presented just there. So those of you watching can read through that. The most important things to note that the group was of 370 males in total. These are male registered professional soccer players, primary ACLR for the ACLR groups, and the rehabilitation was conducted at Aspetar. Exclusion criteria for the group were previous ACL injuries or surgery, or any other knee surgery or injuries for that matter. The controls were matched anthropometrically, and they had no history of any ACL injuries or other serious knee injuries, and were free from severe injury in the previous 12 months. So I'll just give a couple of seconds to look through that table. As I say, they were matched anthropometrically. In terms of the protocol, it's a very simple counter movement jump protocol conducted on forced X. Obviously a between participant cross-sectional design. The participants underwent a standardized warm-up, which consisted of 10 minutes stationary cycling, dynamic bodyweight movements, and then 3 counter movement jump practice trials. Participants were asked to refrain from serious or strenuous, I should say, physical activity in the preceding 24 hours. There were 3 trials performed overall, and the mean value of those 3 jumps was recorded and used for analysis. So in terms of the data collection and analysis, the performance outcome measures that were identified were obviously jump height and peak power. And each jump was divided into its concentric and eccentric phase components, and 6 subsequent variables were considered. The asymmetry ratios were calculated in both the ACLR groups and the healthy control groups. And I've just put the calculations there so everybody is aware of how that asymmetry was calculated. Significance was set to less than 0.05. Effect sizes were recorded. And odds ratios were used in this particular study to best differentiate between the factors that most were best used to differentiate between the ACLR groups and the control group.
And I think, sorry to interrupt, Dan. That's that asymmetry index is quite interesting. I think that was the first paper we reviewed, looking at the range of asymmetry indexes or calculations we get.
Absolutely. So, Chris Bishop is kind of an authority in this particular space. So there are many ways that asymmetry is calculated, and I think it's great that these authors indicated the way in which it was calculated. So the study could potentially be replicated, right, if necessary. So moving on to the results, as I mentioned, there was quite a lot going on here. So what I've done is, instead of putting loads of text on the screen, I'm going to go through the tables, and I'm going to do my best to talk to what they're showing. So the first table we're going to look at are the counter movement jump performance variables. So what you'll see here is groups 1 to 4 for jump height and peak power. Mean and standard deviation are listed, and then you've got your key at the bottom there with your groups that showed significant difference. In terms of the main findings, it's clear to see here that the jump performance did improve with time after ACLR. However, even at 9 months or greater than 9 months, there was a significant difference between the ACLR groups and the healthy controls. So both jump height and peak power remained lower than those healthy athletes. So these guys, regardless of the time period or what time period within the parameters measured here, did not recover to a healthy control group level. In terms of the breakdown of the counter movement jump components, as you can see here, there were 6 variables that were measured, and you've got a breakdown of all of those variables, the asymmetry percentages, and then the changes in asymmetry over time. So just to kind of, without going completely through this, to identify the key findings, there were significant interlimb differences present in both eccentric and concentric components, and these differences had moderate to large effect sizes. So you'll see from the variables as you go through the groups, the asymmetries did decrease over time, as the groups moved away from ACLR. However, as with the performance metrics, they remain significantly different versus the control group. And that was specific when looking at certain metrics. So concentric impulse, concentric peak force, eccentric deceleration impulse, and eccentric deceleration rate of force development. So they were the main components that remain significantly different. Now, if I just move on to the next table, this was one of the outcomes from this paper, where the group identified that there were no real normative values for these metrics in particular. I mean, the 10% rule is often touted in asymmetry when you're looking at between limb differences. But what this table identifies is those normative asymmetries in this specific population were very different when looking at each of the different parameters. So the group identified these ratios, and they broke them down into quartiles. They identified these parameters and these results as a means to compare athletes who have undergone ACLR specific to this population in future studies, and for practitioners to use in real life. And then going on to the final table, which was the associations, where the odds ratio was used to classify which metrics, which measures had the greatest association. So you can see here that regardless of the group, the same components were similar throughout, really. But concentric impulse asymmetry was the metric which was identified as having the most strong association with a history of ACLR. And that's something that when we go into the discussion here, the authors will identify as a measure that can be used going forward. So there is a lot of text here, so I won't necessarily read through all of it. But in terms of identifying the key findings, it's that jump performance and interlimb asymmetry are present in players with a history of ACLR at different stages of rehabilitation versus control. So within this study, participants didn't get back to a level which was considered healthy or normal. Asymmetries were lower in players who were further away from surgery. However, those between limb differences remained significantly greater in players even greater than 9 months post reconstruction versus the control group. As just mentioned,
one option is Wolverine symmetry on back. Does that one sound?
Siri's going mad at me. So, as just identified, concentric impulse asymmetry was the variable which was most consistently differentiated between injured players and matched controls, and was most strongly associated with ACLR. And this ultimately indicates a strategy whereby the uninvolved limb is dominant in the production of total impulse required to perform maximum vertical jump. The authors cited these differences and changes in movement execution in particular as attributed to altered neuromuscular function, strength deficits, reduced range of motion, pain, and fear of re-injury. So a lot of these won't be unusual or won't sound uncommon, but it's important to identify potential reasons for difference between injured and non-injured limb. The magnitude of asymmetry varied per group, as indicated in Table 4, and this supports the notion that asymmetry is a task variable and physical quality specific. The authors want this current study, they want the results to be used as guidelines regarding acceptable levels of asymmetry, and it gives a clearer understanding of what could be classified as normal in this specific cohort, and that cohort being professional footballers. And in the statement at the bottom here, cumulatively, these data indicate that professional soccer players enrolled in a full-time rehabilitation protocol do not return close to counter movement jump performance standards, even after a period of nearly 1 year after surgery. So that's really important, and that's obviously where the subheading of this paper comes into play. Now, in terms of the applications, I think this was a real positive from this study. It didn't just end with the discussion and reasons why. It came with recommendations as well, which I think is great. Ultimately, the top recommendation may not necessarily be something that's realistic in elite sport, particularly soccer. And that recommendation is that longer periods of recovery are required before discharge, and that targeted interventions be included to address these loading deficits before the athletes return to sport. So clearly the results of this study indicate that those performance deficits, particularly within the counter movement jump, they remain even longer than 9 months post ACLR. So I guess a follow-up study would be useful to indicate whether those asymmetries and differences in performance were still present maybe 12, 18, 24 months down the line. Practitioners are encouraged to include training protocols that target performance qualities during their reconditioning period. And of course, that's relating to maximal strength, force production, power output, etc., etc. Practitioners should encourage their players who have suffered ACLR or suffered ACL ruptures even to equal their force distribution early in rehab to avoid persistent underloading. And a key focus should be on quad strength. Obviously, time off your feet, time without exercising, you're going to see decreases in overall quadriceps mass, but also strength. So it's important to address those in the early stages of rehab and look to bring those levels of strength and muscle size back to a level that was normal prior to injury. And then the final statement, which links specifically to the concentric impulse asymmetry, is that it may provide a useful metric for clinicians to determine their athlete's state of readiness to perform. So identifying that specific metric as one that may be monitored throughout a return to play protocol when it comes to ACL rehab. So in terms of the limitations of the study, and these are taken directly from the paper. Obviously, the cross-sectional design only provides a snapshot of player performance, and future research should consider longitudinal measurement of players during rehab, as mentioned. So it'd be great to to have some form of follow-up study here, see what these athletes look like 18 months, 24 months down the line, and whether there was any of the participants that re-injured maybe, and have a look at the specific measurements during a counter movement jump at regular phases post 9 months ACLR. The authors did state that vertical ground reaction forces are not equivalent to the knee kinetic load and cannot identify intralimb compensations. They did follow up with the statement that they are associated with knee joint moments and are clinically relevant to examine strategies used to execute movement tasks during rehab. So I think it's just about having an awareness that vertical ground reaction forces aren't necessarily the be-all or end-all, but can be used as surrogate measures to determine certain joint moments, particularly in the knee. And then further research is warranted to examine if greater concentric impulse asymmetry is associated with heightened injury risk and poorer outcomes after ACLR. And I completely agree with that, considering the association that was found. But also, if I'm chiming in and kind of putting out what I would love to see, is some of these measurements being taken prior to ACL injury. And I know that this is done on a regular basis in club football anyway, but maybe to have some form of retrospective studies that look back at these measurements prior to injury to see if we can identify any relationships between the specific variables mentioned and those at risk of ACL rupture. So that is my review, pal. Do you have any questions that you want me to go over, or is anything that you want me to kind of expand upon further?
No, I think, Dan, you covered it all. It's a really interesting paper. There's a couple of things I'd like to discuss. It's especially looking at some of the data they have and, the debates we have at the moment, I think, in ACL reconstruction rehab and just those general patients. And I think, as you alluded to, the long-term data could be so valuable in doing exactly the same thing, but maybe looking 2-3 years down the line to players that haven't had a re-injury and players that have seen, well, that's a tough one, but, players that haven't had a re-injury and seen how far are they off from their counter movement jump. So, I mean, there's lots of things we can speculate, but some things just aren't possible in a study. But I do think the long-term data will be really interesting. But also it was interesting for me. So as we go back to the background, where the authors discuss, you decrease your chance of re-injury by 50% per month, you delay up till 9 months. If we look at, I think, a lot like the counter movement jump in that, if you compare the 6-month group to the 6 to 9 month group, there's not much difference.
No.
But we know there's a large difference in re-injury rate. So obviously there's something else happening, and as it's obviously not in the remit of this study, but there's lots of research needed in this field.
Absolutely, and look, it's not just limited to anterior cruciate ligament injuries, is it? You could basically take your pick at any form of serious injury and identify variables that are associated, but finding those variables that can be tracked easily at regular intervals, whether that's both before injury and in rehab, to really drive the process and ensure that when athletes do return to sport, they are robust enough to tolerate the demands of training and match play and not re-injure. I mean, that's obviously pivotal, isn't it? And I'm sure that as the research goes on, as we start to see more follow-up studies, we will start to understand these associations even better. And that we know as well as anybody, it's impossible to predict injury, but of course we've got to look for ways to mitigate injury risk. And I think the more of these types of studies, high-level studies that are conducted, we'll start to understand those correlations and causations, and hopefully begin to to identify warning signs before injuries actually occur.
Absolutely. Thank you, Dan. It's such a tough one with ACLs, I guess. And, the type of research that you can do, it's almost, if you had glasses into the future, which I'm sure there were other things you would do, but, to see who would have an ACL injury and to track those guys for years prior to it, to see. But I'm sure that data will be slowly start becoming available with academies and all of that, and the type of data they collect in there. You can look back and see what's happening there, I guess.
100%. We know that data is being collected. So you would think it's a case of practice being ahead of research in this scenario, although they may not actually know about the relationships on a larger scale. So absolutely right. I'm sure that in the future we'll start to see some of those retrospective studies looking back at ACLR athletes before injury, and we'll start to see those associations unfold.
No, absolutely. Once again, though, Dan, thank you. Thanks everyone for joining us. We thought we'd change it up a bit, and we'll try the Monday review. So as always, any thoughts, please do let us know. If you would like the link to the Dropbox showcase, also please let us know. Otherwise, go take a look at our YouTube page. Dan, any final closing thoughts from you?
No, don't think so. Just thank you for watching. I hope I did a fairly decent job at reviewing the paper in a level of detail. And yeah, see you next time.
Cool. Cheers, guys.